Are you a woman standing at a crossroads, eager for change? It's time to connect with your authentic and empowered self at Boss Leap. Join Dr. Sylvia Morris and Dr. Angela Walker in this empowering community where real-life stories of courageous and talented women inspire and motivate. Engage in honest conversations that foster well-being, drawing from our own journeys. Let us guide you toward profound growth and transformation in both your personal and professional life. Here are your hosts, Dr. Sylvia Morris and Dr. Angela Walker.
Welcome back to Boss Leap. I am Dr. Angela Walker, and I am here with my amazing co-host, Dr. Sylvia Morris. And today we are joined by two incredible physicians whose friendship began during their residency together in Arizona and has grown into a shared mission to transform health through lifestyle medicine. Dr. Alli is an internist, a Lean Six Sigma black belt, and she'll tell us more about that, and the author of the children's book Teo and the Super Produce Pals, which inspires kids and families to embrace healthy eating. Dr. Smith is a pediatrician, a national lecturer on financial wellness for medical students, and a recipient of the American Women's Medical Association Mentorship Award for her dedication to guiding the next generation of doctors. Both women are board certified in lifestyle medicine, passionate educators, and change makers in their fields. And together they bring wisdom, humor, and a heart to today's conversation. So Sylvia, we had so much conversation today about health and nutrition in particular, and just want to get your feel on, food as medicine and what that means to you and how you live your life in terms of nutrition and how you eat.
Definitely. I like nothing better than breaking bread.
Yeah.
And I'm the person that has one meal and I start to think about the next meal. So food is one of my favorite topics. And just yesterday, I was at our local farmers market, the DeKalb Farmers Market, buying my vegetables. So it helps me see and get excited with my eyes. And then I bought something new. I bought baby bok choy. I think I'm going to roast it. But what I want to just kind of mention is during my time in academic medicine, I would go to Whole Foods Market here in Atlanta in my white coat, and I would stand near the produce aisle, and I would talk to people about food as medicine. I'm board certified in holistic medicine.
Yes.
And we know that letting food be your medicine, we really are what we eat, is important. So 9 fruits and vegetables every day. And eating the rainbow, which is some of the things that Dr. Alli and Dr. Smith talk about. But what is kind of your favorite superfood?
So I think we touched on this on a previous episode, but I find it to be a kind of a boring answer, but it's salad and kind of Mediterranean diet.
You
but
can do a whole lot with salad. Come on.
Salads of any kind. And I've always been that salad person. I'll put everything and anything into a salad. But that's, some of the things that excites me about making a different salad and putting ingredients in. I guess I've always been that person. And some of that comes from my mother. In terms of, we talked in the podcast about teas, and I remember her having golden seal, like all these herbal things, these herbal teas, echinacea, all the things, and she still has all of that,
right.
and more. But learning how to eat healthy was, I didn't realize how much of a blessing it was. And eating the rainbow, we did that. There was no different food for me because I was a kid, and adult food.
No.
It was, eating, and granted, there were definitely things that are not on the lifestyle medicine menu that we had in our house.
Everything in moderation.
Yeah, some of it just didn't need to happen. But yes, those are some of my favorite things. I am that person, though, that I think I eat for necessity. I don't sit and necessarily dream about what I'm going to eat. But if I go to the DeKalb market, or I am inspired by what I see. So sometimes the recipe comes from those things that I see. So I think it's important to make sure what you see in the grocery store is the healthiest thing first before going, shopping the perimeter of
Which is
grocery
exactly,
store.
that's what I was going to say.
And definitely when we say perimeter, though, more of the green or all of the rainbow fruits and vegetables first. But I think it's so important to talk about this in our communities, in that we can eat healthy and it still tastes good. But sometimes people like me need the recipes or need the inspiration and how to do it. So I definitely see this as an ongoing conversation.
When you go to the supermarket, and let's just be very clear, we have a certain amount of privilege in that
Absolutely.
we can choose the different supermarkets that we go to, whether it's Whole Foods or Trader Joe's or Publix, Sprouts, wherever it happens to be. So we have choices that not all communities have.
Okay.
However, when we talk about frozen foods and even unsalted canned foods,
Yes,
there are still some ways in which that you can eat healthy and use food as your medicine that is pocket friendly. And I think we'll get into some of those conversations when we talk with Dr. Ali and Dr. Smith.
Yeah, so excited. And so without further ado, give you our guests today, and they will be the next voices that you hear. And we hope that you continue to listen and enjoy.
Welcome to Boss Leap. My name is Dr. Sylvia Morris, and I'm here with my co-host, Dr. Angela Walker. And today we are in for a treat because we have not one, but two physicians. So Dr. Ali, Dr. Smith, welcome to Boss Leap.
We are so excited. We cannot wait to get into the conversation. So many questions for the both of you. Such accomplished physicians and women, and just kind of freedom fighters for what I call our preventive medicine push, and particularly with lifestyle medicine. But I'd like to just start with some of the basics, and we'll just start with you, Dr. Smith, Dr. Ali. And we'll start with you, Dr. Ali and Dr. Smith. Tell me, where do you call home, and what inspired you to pursue medicine in the first place?
Dr. Walker, Dr. Morris, thank you so much for inviting us to this awesome podcast. You guys are doing such wonderful things, bringing such brilliance to the community. So thank you again for hosting us. So I'm originally from Michigan, and I really prefer above 80 degrees. And so I moved to Phoenix, Arizona for training for my residency after medical school in Michigan, and decided to stay. I continued as a chief resident, stayed on as faculty as associate program director and founding medical director of the VA residency clinic, and then was recruited to Mayo Clinic. And then just continue that inspiration and starting my own practice and consulting and quality improvement. And I've just really valued wellness and how it impacts health.
And when you say Mayo, you mean Arizona, not Mayo, Minnesota.
But I miss a lot of the traditional values and beauty that you see in Michigan. It's just the weather that keeps me,
I get that. And how about you, Dr. Smith?
Yes, thank you. I grew up in a city called Chino Hills, California. I'm a Southern California girl through and through. Our claim to fame is a famous basketball family, which I grew up playing a lot of sports. And so,
The cow.
Not the cows, though. Thank you for bringing that up, because in the Inland Empire, there were a lot of farms. And so, growing up, we actually lived next to a farm for a period of time. And so I spent a lot of time learning about the way animals were raised, just because they were my neighbors, certainly. And I think the other part of your question was, what initially drew me to medicine. And so I think one of the formative experiences of my life was, as an elementary school child, one of our scheduled field trips was going to the Museum of Tolerance in Los Angeles. And so at that museum, there's a focus on educating folks who kind of enter those doors about the Holocaust. And part of the experience in that museum is you get information about a person who was alive during that time. And at the end of your tour, you find out if that person ended up, living beyond that time period, or if they passed away during that time. And so I had the card of a child, and at the end of the experience found out that that child passed away during that time.
Well, they were murdered, but
yes,
okay.
Indeed. And I think from that time frame, just really, it really struck me and stuck with me, and it made me want to make sure my life meant something, and felt like I wanted to pursue a field that would be impactful, that would positively impact the lives of others. And it kind of came from that formative experience. So that's what initially pushed me into medicine, wanting to make sure my life counted for something.
So in that moment, did you want to go into pediatrics?
I wasn't sure. I think I entered medical school with that on my mind. Again, knowing that, a child lost their life, what I felt was too early, and wanting to impact the youth. I think eventually I discovered internal medicine, pediatrics. I didn't know that was an option. And understanding that there are children who nowadays are dealing with health conditions that typically were thought to be more adult conditions. I think that training has definitely helped me.
Diabetes.
And diabetes, liver disease, fatty liver disease in late teens, early 20s, things of that nature, and just being equipped to help manage those conditions and speak to the importance of prevention, knowing that people are developing those pathologies at earlier and earlier ages.
That's a perfect tease, and we are going to get into food as medicine. But before we get there, let's talk about you both trained together. Yes. Can you kind of talk about your time as residents and what connected you and how you've kept your friendship going over the years?
So I'm happy to start first. So you had asked Dr. Walker about what inspired my interest in medicine. Yeah. So my very first role model is my dad, who is an internal medicine physician. My mom has a background as a nurse and social worker. She has a master's in social work. And so they were definitely first and foremost my role models. And like Jasmine, borrowing from the pain around us and wanting to be champions of solutions, really, that's what found me into the path of becoming a physician. I think it's very important that you have people who really see that we can do something with our impact, with our background, with our training. And so it was only natural that on my tours of various medical schools around the country that I should meet somebody like Jasmine who shares, or Dr. Smith, who shares so much of the same passions. And we really just got to talking. She actually took me out to dinner that evening. And that's how I knew that this was the program for me. I was like, any place where she would sign up, so I got to be. So, and we did. And we've been
awesome
friends ever since, in mentorship capacity, in really learning how to forge our pathways together. She's always been an amazing friend and inspiration, and someone that I can bounce ideas off of.
And I would say that what I've learned from our friendship is the importance of even kind of peer mentoring, because I believe we've been each other's peer mentors along the way. So whether that be from, just kind of trudging through residency, because it's a challenging time, and even talking about, our, post-training careers and understanding, just kind of tips and tricks around promotion, around advocating for yourself, around curricula development and things of that nature, being able to bounce ideas off of each other, and just kind of enlighten each other to resources that will help us continue to have success in our professional journeys. It's been very rewarding, and I've been incredibly appreciative of Dr. Ali and her ongoing advocacy for others. And she really wants to see everyone around her win. And I think that's something that definitely
I'm playing PJ Khaled in my head.
Yes, indeed.
Indeed. And I can certainly relate to that, working with Dr. Ali, and just some issues around maternal morbidity and mortality and health equity. I think we're all part of what Sylvia would say, the mutual admiration society. And when you find those people in your life, particularly, when you're in a field where people outside the field don't necessarily understand the demands and the highs and the lows of it, when you can find that person, it's really it's a godsend for me. So I find that in my friends from medical school, and then those people that I've picked up along the way. So I'm grateful. So thank you for sharing that. Here's a question, kind of going in a different direction in terms of leadership. And Dr. Alli, I would love for you to tell us a little bit about Lean Six Sigma. You are a black belt, and I know I've always heard of it and thought of it more in the, I think, business realm. But I'd love for you to tell us a little bit about it and how that shaped your leadership style in medicine.
Thank you for asking. And okay, mirrors. So in terms of leadership and modeling behaviors that are towards, promotion, yes, I appreciate all of you. So Lean Six Sigma comes out of automotive industry, and it really was adapted to medicine, and with the intention of highlighting areas of inequity, areas of improvement where we can use standard methodologies. It's actually a dedicated science to be able to identify the underlying cause of a problem and then come up with high-level solutions. And so it's very methodological, it's intentional, and it also includes the use of stakeholders, so people who are directly touching the process or maybe have a vested interest in the outcome, and bringing those people together through dedicated evaluation of what the process looks like.
So like a root cause analysis.
That's definitely one aspect for sure.
Okay.
And what's critical about it is that when you use this approach, you're able to come up with high-level interventions that promote better morale for the institution. So my chief resident year was as a dedicated chief resident in quality and safety. And during that year, I developed a curriculum that spanned 2 hospital systems dedicated to teaching our residents, medical students, faculty, and staff at large to solve ongoing process issues that would either directly impact patient or just impact workflow. And that work, thankfully, made significant improvements in outcomes throughout the system, and then also was awarded through the Institute of Healthcare Improvement. It actually won number 1. Yeah, it was fantastic. Yeah. And that approach is very similar to what Dr. Smith does in her day-to-day, also with her financial wellness curriculum. Many of us do this intuitively, frankly, which is the neat part. And I'm just grateful to be able to consult with the American College of Physicians and working with systems across the country.
Let's shift gears a little bit. Dr. Smith, you brought up peer mentorship and so the importance of that and the relationship that you have with Dr. Alli. You received an award from the American Women's Medical Association on mentorship. So could you talk a little bit more about the importance of mentorship and what's it meant to your career?
Yeah, certainly. Thank you for bringing that up. A couple years ago, I was part of a podcast that talked about the hidden curricula and the hidden curricula of medicine. And a lot of that piece of work talked about how not everyone is privy to information that can directly lead to your promotion and success in your field. And
Dr. Smith, before you get too far, who is the curricula hidden from?
That's a great point. I think it's hidden from those who may not have had access, whether it be from family members or peers or their social circle, to some of the things, whether it be in awards available, whether it be in resources available, whether it be focused on specific ways to present your work, specific advocates that may be available, specific funding that may be available. And generally these resources and information is siloed in specific circles. And in those circles, it oftentimes is shared with folks who generally look like them or folks who just kind of limit that information to their own circle. And if you're not part of that circle, then you're not privy to that information. So for instance, Dr. Alli and I started a diversity mentorship program when we were both living in Arizona, really kind of focused on unveiling that hidden curricula to students in the area. I actually recall being a medical student and being told that a lot of the content that was being presented to me seemed like it was very new to me. And it was a striking comment because I thought it should be new to everyone. And I remember being asked if I had other family members in medicine or what my previous experience in medicine had been. And I said, I don't.
I'm sorry, you're in medical school to learn how to become a physician, so why should that matter? But please continue.
Right, indeed. And so it really struck me, right? It struck me as, I thought of myself as a person who was working hard, learning the material, and yet the impression I was making was that things were new to me. And so it got me thinking about, okay, what am I missing? Yeah. What is different in the way that I present information? What is different in my approach to things? And just kind of paying attention to those around me, really searching for other resources that were available. I kind of almost made it a mission to try to make those things available to those who were coming after me to make their road a little bit easier. And so mentorship has been part of my entire professional career. Everywhere that I've gone, I've helped to start programs. And so I live in Los Angeles now. And so, started a program in Los Angeles, kind of developing mentorship families, focusing on medical students, medical trainees and faculty members to, again, unveil that curriculum and make sure those coming behind me don't have the same experience that I had, that they aren't looked at as different or othered because they may not have had exposure to certain things that other people may have had exposure to.
Can you share the name of that program?
Yeah, so the program that I'm affiliated with today is called the Opportunity, Integrity, and Impact Mentorship Program, based in Los Angeles. And so that's a program that focuses on students interested in pediatrics in the immediate Los Angeles area. We generally work with students at the Keck Medical School of USC. Yeah, but also expand the opportunity to students and trainees throughout Southern California.
Well, I have to comment on this aspect just because financial wellness,
yeah,
I think I can speak for Sylvia as well, was new to us as well. And so, that's the book that we wrote, the game plan.
Yes.
That was one of the key features in terms of get financial planning now while you're in medical school. Things that we didn't know. And I was working my first practice and not contributing to a 401k. Nothing. And it's just for lack of information. So to put that out for women, for people of men and women that are in medical school, so important. And I strongly believe it should be a strong part of our curricula for everyone, right? Regardless of what you know or don't know. But if it's not in the curricula, you've got a program out there, and then we need to be doing our part in sharing this information, this important information, with those coming behind us. So thank you 100%. Both. And obviously, thank you both for your leadership and what you're doing. And in terms of leadership, that leads me to the next thought that I have in terms of both of you guys. You're definitely farther along than I am in terms of your board certification in lifestyle medicine. I'm new to the game, not new to the thought process or the passion behind it, but definitely new to the actual discipline of lifestyle medicine. But I'd like to know what drew you guys to it and how it's changed the way you care for your patients. And Dr. Alli, if you want to go first.
And I'm glad you highlighted that distinction, Dr. Walker, because for some of us, we have been practicing this way or we're aware of it. What was great about the certification through the American College of Lifestyle Medicine is that they really centralize a lot of the resources. There's like a powerful community of people that reverberate how critical this approach to clinical practice is, where we're centering everything from nurturing activities, eating plant-powered foods, exercise, sleep, and stress management, as well as timed mindful breaks. And so I actually learned about the value of food as medicine as a child. So, hearing the message in my home was make sure you're eating something green on your plate. Also, my dad banned sugar cereals when we were 6. I still remember how that felt. And I have so much great gratitude in hindsight because a lot of those efforts laid the foundation for how I grew up. And so I had this fantastic professor in medical school, Dr. Jillian Bice, and she did this really funny skit about how a lot of our food can be made so simply with just a few ingredients, the way like some places do with just changing the shape of the food, but the same key ingredients. So she was talking about like Taco Bell, for example. And so her point was, you can do that in your own homes as well, picking 3 key healthy ingredients and then integrating those into different ways. So I really ran with that message into my residency. I started a dedicated shared medical appointment with my dietitian for the clinic. She was fantastic. We would bring in fresh produce for our patients to try during the appointment. Yeah, it was fantastic, the level of engagement. And then at the VA, we would do this with the veterans. And I had a really wonderful setup where I had a dietitian in the room, social worker in the room. But really, the truth is the veterans would teach one another. And so it would highlight the value of low sodium foods on blood pressure and heart failure risk fast in terms of reducing exacerbation. And we would highlight how easy it is to create meals at home. And so that informs what I do today. The same message was at Mayo, the same message I would carry now, where we have shared medical appointments for our patients. We also teach through innovative ways, including storytelling. And again, the whole point is, how do we get this message that really needs to be accessible and front and center for everybody, no matter what your age is, that what we eat really adds to how long we live. So, and we want to make that from everywhere from what's in your pantry to literally what our policies support, what our government support.
How about you, Dr.
Certainly. Similar to Dr. Ali, this has been something that's been top of mind since I was a child. My mother would often have nutritional healing books throughout our household. And so I always knew when a new version came out because it was right at our doorstep. She was really passionate about using the things that we eat to impact our health. And even when we were, acutely ill, she was like, well, these teas are helpful. You need to drink a tea with echinacea. You need to have this. You need to have that. Where is your vitamin C, et cetera, and really encouraged us to be mindful of just kind of a larger framework for what included health, that health went beyond medications. And even though those things could be helpful in the acute setting, there were other things that were helpful in the acute and long-term setting that could support your health. So that was something that was part of my childhood. Additionally, I think it's been really difficult. I spend most of my direct patient care in the inpatient setting. It's been really difficult to see obesity and chronic illness, diabetes, liver disease happening in children who are school-aged. And trying to understand what we could do to impact kind of behavior change, and understanding that, those children are often part of family units. They may not be the major decision makers related to what is actually in their home. And so wondering, how could we impact families, right? What could we do to impact families? What tools exist already to help impact families? And lifestyle medicine was a way to obtain more resources, more training, a different framework that I could use when a family member or a patient would ask me, well, like, doctor, you say, I need to change my lifestyle, but how do I do that? What does that mean? What are the steps? Because we can say that all day, but what does it actually mean in the home?
Resources.
Right. What does that mean? Like,
yes.
I don't know how to cook, doctor. What should I do? It's expensive to get organic produce. What do I do? And so just having the tools and being equipped to say, here are some options, right? Here are some things that you can do is what really drove me to lifestyle medicine. I've been thankful for how I've been able to incorporate that in my practice.
Well, thank you so much for sharing that. Letting food be our medicine is really important. And the policy side of it, we could talk ad nauseum about that. But let's just pull it back to the food part. Can you talk about your favorite superfood, or is there one food that you're like, everybody should think about adding this to their diet? We'll start with you, Dr. Ali.
So my favorite is sprouted tofu. And,
wow. Wait.
Yeah.
Okay. So there's fermented tofu, there's firm tofu, there's soft. Please explain.
So there's so many different varieties of tofu. Yes. The common ones you'll see in the store are like soft, silken, and firm. And then there's a subcategory of sprouted tofu, which is firmer. The reason I really enjoy it is its texture. It doesn't have a lot of moisture when you take it out of the package, so you don't have to spend 30 plus minutes to press it. And it has such a wonderful texture. So we actually take it right out of the package and put it into the pan. For those who may not know, sprouted tofu First of all, tofu comes from soybeans. So it's high in fiber, high in protein, especially. And it's a full protein. So you don't have to eat a lot of other things to help get the necessary protein that needs to build healthy muscles. And the other value added is sprouted means that you're getting higher density of nutrients. It actually is better digested in your GI system, your gut system. And it is very filling. So, and you combine that with something like brown rice or other vegetables, you're really trying to eat the rainbow. It's fantastic. The reason why I love it.
Sprouted tofu everywhere, or do we need to go to a particular type of specialty store?
Very good question. I found it at a lot of places. There are some grocery stores, depending on the neighborhood, and this is where that policy thing that you were talking about becomes a real challenge, is because it really must be available everywhere. There are grocery stores that are more consistent with that messaging, so you will find it. I would say for those who want to save gas and time, call in advance. But yes, there are definitely grocery stores that have it.
Is it expensive?
No, very, very good question. It is not. And especially when we're talking about being cost sensitive, which I'm so grateful that you brought up, this is cheaper than meat. It also is higher nutritional benefit. It's better digested. And you don't have to worry the same way because you actually get a lot of time for that product to sit in the refrigerator if you need to, compared to if you're eating meat. Yeah, the shelf life is better. But the reason I bring it up is my little one brought it to school and was telling me that his friend was saying, tell your mom to bring some more of that tofu.
That's that.
And they do it with broccoli too. But between sprouted tofu and hemp seeds, you're good to go.
Hemp seeds. Okay, great.
Yeah.
How about you, Dr. Smith?
Mine are any leafy greens and berries, and specifically because you can grow them. And so you can grow them. You can grow blueberries. You can grow collards. Yes, you can. Yes, you can. As a matter of fact, I was shopping. I was out shopping and I ran into a woman, and she was buying soil. And I was like, is this one, do you grow your own food? She said, yes. She's like, this is the best soil. She also lives in the city and shared, the expansive garden that she had crafted in her yard, but it doesn't take a lot of land. All you need is maybe just a corner, maybe kind of outside, or a quarter even in your own home. And you can grow these things. There are a lot of systems that are in place right now where you just need a little bit of space and you can grow your own food. And so my favorite superfoods are the ones that you can grow. You can grow collards, you can grow kale, you can grow spinach, you can grow berries, you can grow tomatoes. And it doesn't take that much effort because specifically where I live, the climate is it's hard to mess that up, right? There are certain climates where you have to be a little bit more mindful, but we all have it within our purview to grow something, right?
So for your thumb, is your thumb green?
It is not. And that's why I'm an advocate for it, because I am not the best at this. I'm like, well, let me see if I drop some seeds, if something will happen. And it often does, right? And even, let's just say you take some seeds from a fruit that you've consumed at home, you can drop those seeds and you can watch them sprout and it can turn into something amazing. And
don't you have to dry them out and then sprout them in the little plants and then transfer to...
There are definitely levels to this, but you can also go to your local grocery stores often, or even your local Costco, and they already have some of the items that are beyond those stages that you can just take home and transfer. So it is accessible. And, if you want to start from the beginning and sprout your seeds, you can certainly do that, but you don't have to. And there are cost efficient ways that will allow everyone to have this access and to be able to grow their own produce.
And I just want to add, is it okay? I just wanted to add to what Dr. Smith said. That's so important to closing that visibility gap, because what we show children, which is often that food only comes from one place, which is a store. Right. When we show them that you can grow that at home, they're more likely to eat it. It's just very empowering. So well said.
Well, that was a perfect segue, Dr. Ali, because I want you to tell us all about Teo and the Super Produce Pals. I have too. So truth be told, when I got this book, I am so passionate about it because I am searching for all the little kids that would be empowered by this. It's such a beautifully written, very thoughtful. I've got 2 grown kids, but it is absolutely something that I would have shared with them, because you're always searching for something that is teaching them something positive, whether it's body image, but certainly what you're putting into your body. And Teo is so excited about eating healthy. So it's already very apparent that, and I'll let you talk about your own book, but it's very apparent that he has been taught that fruits and vegetables are good things for his body. So everything through the grocery store, but also the intent that was put into the book is not only telling the story, but you also have resources, and then you've got activities for the kids to do, and recipes.
Tell us about your book.
I appreciate you so much. And
I'm so sorry, but I'm very passionate about it.
It's a testament when someone like you sees the value of the book and you can explain it. So I appreciate that so much.
Yes.
And I just want to give a nod to Dr. Smith, who is an endorser of the book, which is awesome.
Yes.
We also have endorsements from the Executive Vice President and Chief Health Officer of Blue Zones, as well as President of the American College of Lifestyle Medicine, and dietitians and parents supported. Yeah, it's really wonderful.
As it should be.
Yeah.
Tell us about kind of the inspiration for the book and who the target is and all of those things.
So I've always wanted to write a book, and specifically given how food as medicine was always part of my upbringing, it's always mattered to me that all children, all adults, everybody on this earth has the ability to eat food that is nutritional, food that is nourishing, food that supports health.
Political and revolutionary. I like that.
Thank you. And so in writing this book, I was very intentional to capture what I see in my own home with my little one and how he brings so much joy in grocery shopping. It's really a delight to watch him, so much so that people will stop us and ask what he's putting in his cart. He's that level of energy when he's shopping. And so then the uniqueness about the book is that you're getting this message, like you described, through the eyes of a child. And so I want other families, I want children, and both adults and children, to be inspired that this can be child-led. So the book really highlights the value of plant-powered eating for health over a lifespan. It also highlights a variety of people across neighborhoods and communities who are shopping in this grocery store. You also see people who are living with a variety of different abilities. So we have depicted an employee who has a below-knee limb difference. You have a child who's in a wheelchair. And so the intentionality is that everybody benefits from eating this way. The other message is you see the way the child interacts with the employees in the store, in addition to with mom, and everybody's on the same page that eating this well is towards health, towards growth, towards well-being. And that was actually our experience at certain grocery stores where you see the way that they interact with children. They're encouraging, they're sharing carrots and letting them pick bags from their hand. They're asking them questions about what they're eating and asking if they know what it does to the body. That's the level of engagement that we want everywhere, not just in the grocery store, not just in certain homes. We want this in schools and community organizations. Because if they're not hearing it from us, what they are hearing are these other very passive messages where we're talking
commercials.
Yes. And the data shows, as Dr. Smith can attest, that the more they're hearing that kind of messaging, the more the prevalence of obesity. With this being in the last decade, the highest of obesity in our children. In the last 10 years, this is the highest rate of obesity. And so we really want to get the message out that we have some power in our hands, that we do not need to wait for other people to make this kind of food available to us, that we can grow it, that we can buy it, and that it doesn't always have to be expensive. It doesn't have to always be organic. Frozen food matters. Canned food matters. Dried food matters.
I love that part.
Yes. So, and a lot of those tips are in the book. They're the green pages of the book that have like tips on how to eat that way. There's some recipes in here. So yeah, I was trying really to be intentional about making this as a book across all communities. So
there are so many takeaways from it. One of the messages in there, one of the grocery store attendants asked Teo, he's asking for carrots, I think. What do you dip your carrots in? And he says, a bowl. And then he's like, oh, hummus. In other words, like, I don't need to dip it in anything. Like, the carrot is good all by itself. But just the positive messaging, and as you said, I could relate to it from as a parent, like reading this to my child. And so I can't think of a better children's book. I mean, and I have several in my repertoire, but in terms of addressing health and well-being. And so kudos to you both for, you know, what you put into the book. And I know, Dr. Smith, you're completely endorsing it, but my endorsement is not going to mean as much, but I completely endorse it, particularly for our listeners that are looking for something, positive, not only just positive messaging, but just something that can actually potentially affect a child's health. And like you said, it's affecting their health long term, which also affects the health of the family long term.
And why don't we just go ahead and say it now, and it also will be in the show notes. So where can we buy the book?
Thank you for asking. So the book is available in a couple places. So it's on my website, which is www.wellnest.com/books. So wellnestmedicine.com. It's also available on Amazon and also Barnes & Nobles. It's pretty much where books are sold, but those are the common places that people are buying the book.
Wonderful. And Dr. Ali, this would be great for a holiday gift or a birthday gift, or today is Tuesday.
Yes, it's exact.
Right.
An any day gift, yes.
Yeah, or part of your reading circles. I know a lot of communities organize reading events for the children. And so
Great idea.
It's colorful, it's engaging, and that's what kids are attracted to.
Yeah, the illustrations are fantastic.
Yes.
Yeah, so.
Thank you so much. I also wanted to share that we are reaching out to pediatric clinics across the country to be able to evaluate how this book impacts health behaviors in homes. We're also seeing clinicians who are using the book as a talking piece in their clinics to generate more spontaneous discussions around what we're eating and resources and accessibility of food. Because we do know competing factors like food access is a critical concern. So we want to make that a priority. The book also is a nice window to a grant that I received from the American College of Physicians. And that grant is to bring to the table more opportunities for people to eat this way through, one, teaching our clinicians across Arizona first and foremost, but then across the country about how to lead with food as medicine in their practices. The other aspect is we're reaching out to community-based organizations to be able to do, like Dr. Smith said, garden and bring more of these seeds literally to the table to grow our health over the long time. And then the last aspect is really just emphasizing the value of coaching in these dynamics, because it's not a simple process for some, although small steps really do matter. And so a book, a story, an opportunity to have a discussion with people that love you, all of those are ways to build this messaging about food as medicine closer to home. So excited about that as well.
In terms of what you're doing, which I completely champion in Arizona and hopefully nationwide, but when you were talking about the sprouted tofu, Sylvia and I are both like, where do you get that from? What I have noticed sometimes in your grocery stores, when they don't have something, ask for it, because oftentimes if enough people ask, or if you are that squeaky wheel, and they may bring it in, see how it sells, but oftentimes you can be that inspiration for them to bring something healthy into the store.
You are brilliant. And that actually goes for so many different things. And that's the way we want to be catalysts. So starting even in your communities and asking for food that matters, for food that settles the heart, that helps the body grow. And also the book, you can actually ask your library to order the book, so that it doesn't have to be a cost-limiting factor to have access to these resources. People have been doing that around the country, and it's really impressive. The book is available through wholesale distributor that also distributes to libraries too.
Nice.
And I wanted to share about the sprouted tofu. A neighbor had been talking to my son, and now she eats sprouted tofu weekly.
Yes.
So
He was the catalyst there. Beautiful.
But that's how we can spread the messaging. So I'm so grateful that you brought that up. But yes, we can make those differences.
And I think sometimes we assume that even like our grocery store workers have all of the knowledge kind of around, the benefits of foods and, the antioxidants, et cetera, et cetera.
Right.
I had an experience.
A living wage.
That part too.
And even conversation.
It is. And I remember being in the grocery store and asking for turmeric root. And the gentleman said, well, what do you do with it? Yes. He was like, well, how do you use it? What do you use it for? I was like, oh, you can put it in your tea. You can do it. Right. And so not only is that going to increase the demand for that product in that store, but now that person can take that knowledge home and share it with their family members.
Very good point.
Yes.
Let's just kind of go back. I want Dr. Alli and Dr. Smith, you to go back and talk to the woman that graduated from medical school. What advice would you give to her? Dr. Smith, let's start with you.
Okay. 2 things. 1, you are prepared for the next step in your professional journey. Even if you feel like you are not, things will come out of you that you don't expect. The diligence, the time, the seeds that you have planted, they will sprout and they will pop up even at the most unexpected moments. So you are prepared for the next step. And then the second thing I would say is the things that are meant for you will come into your path. You don't have to fight. You don't have to fight for them, right? You are already equipped. You have everything within you that has prepared you to take on this task, this award, this journey, this position. And it's not something that you're going to have to fight for. There are things that are designed for you that you don't have to fight your way into those things.
Yeah.
That is why we're friends. What Dr. Smith said, it's finding your medical home. And this actually is advice that works for everybody. But the idea is that when things feel fixed in terms of options, expand your options. And to do that, more friends, meet more people, just say hello, just ask. You really have nothing to lose in asking. You only to gain. And when you ask, if one person says no, find somebody else. Because you never know where people are coming from. They may be having a bad day. They may not have eaten that day, frankly. There are so many different contributing factors that lead to that person may not be the resource that you need. So find somebody else, but definitely expanding your circle, expanding your world. And the last piece is towards what we were talking about, Dr. Walker bringing up the social contagion. If you speak it out loud, it's more likely to happen. So doing that strategically, asking for things, whether it's sprouted tofu at your grocery store or asking for friends who can speak your name out loud. All of those things are really critical in terms of sponsorship, mentorship, and promotion. So, but yeah, don't be afraid to expand that world.
You guys are so wise. Thank you so much. Great advice. And with so many hats that you've already, and I know so many more that you're wearing, but as physicians, author, mentors, educators, we'd always like to know how people recharge themselves. How do you guys practice self-care? We know you do very well in terms of nutrition, and you can expound upon that if you want, but just love to know what your self-care regimen looks like. Dr. Alli?
So the funniest part about having a kid is that they are natural accountability buddies. And if you start even one routine on one day, they will hold you accountable and ask you about, why didn't you do this? We did this yesterday.
Yes.
And they also find joy in the smallest and most important ways, and they move naturally. So that's what I would say is my recharge, is trying to center myself and be mindful through his eye. And that's been really rewarding. And when I don't do that, he lets me know. So having an accountability buddy is critical. And you can find accountability buddy in anybody. And if you don't have a kid, borrow a kid. But the reason I bring it up is that there are so many important people who have the ability to positively influence the children around us. And so if you have that ability to do so, and it's in genuine and kindness, and you ask first, I think there's just so much joy to be shared mutually. And that's why I bring that up.
Very good.
Yeah.
Dr. Smith?
Yeah, for me, I'm a woman of faith, and my recharging is focusing on the truth of who I am, the truth of what I'm here to do, the truth of the impacts that I have had, the truth of those in my life who speak life into me. And so that's a way that I recharge, is what I call just focusing on what is true. what is actually true, and meditating on that and focusing on that. And then, I love retail therapy. And I love going to new places.
You from LA.
She's our friend.
And I love going to new places. So I enjoy traveling when I can, and really kind of seeing the way things are done in different places and the way people live in different places. That's always been something that's interested me. And I really learn a lot, and I just enjoy being immersed in other cultures.
Very cool. Very good. You all guys, you both have been amazing. And I think, this is why we wanted to have you on. And so we appreciate you sharing and your transparency and all of your knowledge. I'm wondering if you are willing to have a quick, just rapid fire round. It's very quick and easy.
Okay.
No heavy lifting, no heavy thoughts here. Yeah?
Yeah, sure.
All right.
Start morning person or night owl, Dr. Smith.
Night owl, 100%. The morning is not. The morning is often a struggle for me, but I'm learning. But I love being up at night.
Both. Yes, both. Yes.
And it's funny, Sylvia and I have answered this question in our own lightning round, and we're both neither. As Sylvia would say, morning people by occupation only. But
Hilarious.
all right, here's the next one. And I'd love to hear this one. Go-to comfort food.
We make this mac and cheese that's made with silken tofu, onions, red pepper, these amazing spices, and it is so good. And the reason I know is because my little one will eat it all up. So yeah, it's so good, and it's and we use a bean-based noodle. I'm telling you, if I didn't describe it first and you ate it, you'd be like, okay. Yeah,
I'll take the recipe. All right, please. Sounds good.
Mine is grits with cashew cream, topped with grilled vegetables, particularly a mix of oyster mushrooms, collard greens, tomato, onions. And so that is one of my favorite things to eat. If you ever come to my home for brunch, that is always on the menu.
And do you share a recipe as well?
I do. I am happy to do so. Yeah.
Perfect.
Favorite book?
Damn.
Good answer. Good
Easy for you.
Good answer.
We put a lot of love into it. I did want to really quickly shout out through our mentorship program, Paulina Awua Siddiqui. She and her husband, I met through the program that we mentor, and she's now a second-year resident in internal medicine, and she's one of the co-editors of the book. And so, just bringing it full circle. So
yes, awesome.
Yeah, that's a tough one. I would say the autobiography of the month, because I like hearing about other people's journeys. And so right now I'm reading Cicely Tyson's book about her. So I enjoy learning about the journeys of others. And so my favorite book is usually whatever autobiography I'm reading at that time.
Cool. Okay,
Yes.
cool. All right. One hobby or activity that instantly makes you happy.
dancing all day long. We actually did Zumba together all throughout residency.
Yes, we did.
That was our decompression.
Indeed.
Line dancing?
It was Zumba.
Zumba. Okay. No, I'm asking you. Line dancing?
It is kind of like line dancing.
Okay.
So, mine is probably playing basketball with my family. I come from a family of athletes, and so, you know, my siblings and then the next generation will get together and we'll play games, and so I enjoy that time.
Are you a Laker fan?
I've been a Laker fan since I was 5.
Okay, I don't need to turn the camera off then. I was saying for Sylvia's sake.
And finally, a dream travel destination.
I'll go first. Mine is Jeju Island in South Korea. Ooh. It's beautiful. It has been on my list for about 10 years. I want to go visit there. What I've seen of it, I just want to experience it in person.
Okay.
Yes.
I haven't heard that one.
Anywhere in the Caribbean, or I think that would be my spot. It just has to be warm. Refer back to early show notes.
Kindred spirits there, yes. Very good. Well, ladies, it has been an absolute pleasure. I'm grateful for the experience. Thank you for taking the time. Thank you for your intention in enlightening the community and those around us and inspiring the young people and inspiring your peers as well to live the healthiest version of yourself. And I hope that you continue to do what you do and continue to grow and continue to help us as I'm coming behind you in this lifestyle medicine journey, but just continue to learn to live the healthiest version that we possibly can. So until we meet again, and actually, before I do that, I would like to give you an opportunity if you have anything else that you'd like to share with our audience, and we'll definitely put your contact information in our show notes, but anything that you'd like to leave with in terms of parting words, Dr. Ali?
Dr. Smith, you want to go first? I would like to highlight that if it feels hard, it's worth doing. And this is worth doing. Eating this way is worth doing. We do offer resources through Seeds to Inspire Foundation, which is the organization where I'm Chief Wellness Officer, and we are doing a lot of the grant work through there. So if we have the ability to support people remotely through presentations or directly here in Arizona and more hand-holding, we are happy to do so. And I also just want to say thank you to you and Dr. Morris. It is enlightening to find other people who illuminate others and believe in walking alongside each other towards our goals. And I'm very grateful to be in the presence of such strong and brilliant people and leaders. So thank you also, Dr. Smith.
Yeah. Mine would be, and it's something that, many people have said before me, but it's to choose your hard. Discipline can be hard. Discipline in your eating, discipline in your physical activity, discipline in your sleep hygiene. All those can be difficult. But it's also hard to deal with the ramifications of not doing that. So we have an opportunity to choose the hard thing. You can choose to be disciplined now, or you can choose to deal with the sequelae of your decisions. And, the health impacts, the negative health impacts of not prioritizing these things earlier in the future. And that's hard too. And the other thing I'll say is, nutrition is incredibly important. I also am a big advocate of personal finance, because if you aren't managing your money well, you may not have the resources to obtain the things that you need to continue to live a healthy life, right? And so just being mindful of living beneath your means, if feasible, and planning for your future so that you have resources that can help impact the health of yourself and those that you care about.
I have one more small thing that Dr. Smith just reminded me, and it's that routines are made for us and by us. So there are routines that we do that we don't even realize. So for example, at one point I was stopping off and this was several years back, but I was stopping off and getting a donut before work. And I was like, I earned this, I deserve this. And then I had to change my routine because I had to drop off my kid for school and I couldn't drive by there anymore. And so what I had made was a routine that wasn't allowing me to be healthy. What I had to do though was plan my breakfast more accordingly, get up earlier, be more intentional about what I was buying and thinking about then what I was eating. So changes in our routines are critical towards that. And then the very last quick thing is that when you can choose a food that offers you layers of benefit, you're doing well. So think of it in the way that if you could find something that makes you feel good when you put it on as a dress, but also looks good. So it's comfortable and it fits well. It's the same thing with your food. So if you're picking foods that not only provide you nutritional benefit, but you like the way they taste, you're more likely to eat them. So you want to position those kind of foods front and center in your refrigerator, on your counter. You want to plan them into your routines and when you're driving or commuting so that you're having those things at quick access. But the more you can layer your nutritional benefit, the better.
Well, ladies, as they say, you guys have dropped the mics. I don't think I have anything to add there. I don't even know if we'll end up doing pearls at the end of this, which we typically do because you've just dropped them all over the place. So again, thank you so much. And until we meet again, may you be well.
May you be well as
Thank
well.
you.
To health.
To health.
Cheers.
Angela, that was a fantastic conversation with Dr. Ali and Dr. Smith. I have a list of things that I am kind of thinking about. So what did you learn?
I think so much. They're very inspiring in everything that they're doing in terms of how they practice medicine, their philosophy in terms of teaching. I think the comment was social contagions. And the idea, I learned this at my grocery store, of just asking for a product. I was looking for something. Who knew? But I learned that myself by asking for something. They're like, well, I don't know. Maybe we can get that. I was like, oh, okay, maybe you can get that. And I think a lot of people would buy that if you get that. So asking for the healthy options sometimes requires you to actually, make the effort to do that. And maybe if you have 2 or 3 friends that shop at the same store, but in order to get some of the healthy alternatives, I love, because I was so excited, as you could tell, you had to cut me off, about her book, just because it resonated with me so much in terms of what I believe in my philosophy in terms of teaching children. But they really are, it's so cliche, our future. So making your kids excited about eating healthy, and what she talked about is her own child, then it's contagious to those around him and even to his peers and to the adults that interact with the child. So there's value in, being diligent about teaching our kids about the importance of eating healthy, eating the rainbow, eating, or teaching them food is medicine and just preventative measures. But most importantly, to teach them it's good. It tastes good. That's all that
the exposure and making it taste good. You just don't want to dump it out of the can or take it directly, from the freezer with no flavor and no seasoning, no salt,
sometimes
whatever it is.
Right.
It is, absolutely.
Yeah, that was good. And then lastly, for me, in terms of what I learned about sprouted tofu. And I did have a chance to Google real quick after our conversation. And at least the closest thing to me is a
Trader Joe's,
which is now it's in Atlanta. So Trader Joe's. So I'm sure there are plenty of grocery stores. I did not Google them all, so I can't speak for all the stores. I'm sure all the stores want to carry sprouted tofu. But at least I found a place that does, because I do like tofu. I like cooking with it. But it is sometimes it can be a process, but it's still an easier process to do. But
you're going to have to help me with that. I'm queen of veggies. The tofu, the texture has to be right for me.
Yeah.
And the flavor. If either one of those things are off, then I'm out.
Well, so this one sounds like it's most like the firm, just once you get and you can use it like ground meat and make tacos. So I do Taco Tuesday. I do that, season it up, and, put everything else you would do. I can do vegan cheese and that sort of thing. And then
next time I come to your house,
we'll do it. Okay, enough about me.
Heard that.
How about you? What did you take away?
I really enjoyed. There were so many things that I learned, and the concept of peer mentoring, I think it's really important. Sometimes you are in situations where there are not many like-minded people. And if you have a peer in which you vibe well, then you all can do peer mentoring. I think that is good. Absolutely. You and I have been each other's mentors throughout a very long time. And then I would say when she talked about, Dr. Smith in particular, talked about unveiling the hidden curricula. And with our book, The Game Plan, A Woman's Guide to Becoming a Doctor and Living a Life in Medicine, we too were working to unveil some of the hidden curricula. And I think that it's important that we share information, that we make it easier for the next generation of physicians and healthcare professionals by simply sharing information. So I think that was really important, and one of the many learnings, in addition to food is medicine, which we can talk about all day as far as I'm concerned.
Absolutely.
That is really important.
Yeah, maybe we get some recipes together.
Yes.
End of next season. So, yeah, this was fantastic. It was a little bit in the making, and it just turned out to be perfect timing. We're so grateful for Dr. Ali and Dr. Smith for sharing their insight and all that they're doing to make our world healthier. So I think that's it for this episode. We would love for you to like, subscribe, and share this episode, particularly if anything resonated with you. You can reach us at bossleap, L-E-A-P, podcast.com. Give us any messages you'd like us to know. If you'd love to hear something in addition to this episode or future episodes, please let us know. And you can subscribe on YouTube. Would love to hear you there as well. And until we meet again, may you be well.
May you be well.
That's a wrap on another episode of Boss Leap. May this conversation enlighten your path toward personal growth and professional empowerment. For more thought-provoking and eye-opening discussions like this one, head to our website at bossleappodcast.com. Always remember to celebrate your wins and trust yourself. A positive mindset can push you out of your comfort zone and into far greater heights. Until next time, may you be well.
Before we go, there's one more thing the lawyers have asked us to include. You know, it's the legal language. And you know how doctors love lawyers. This podcast is presented only for educational and entertainment purposes. Although we are doctors, on this show, we are just your friends. This podcast is not intended as a substitute for the advice of your physician, professional coach, psychotherapist, or other qualified professionals. Understood? Awesome. We'll see you in the next episode.